Hi, good morning Andrew. My name is Victoria Reyes. I'm your invigilator for the OET speaking session on the 19th of August 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Mars.
And what is your candidate number, please?
My candidate number is 2020142.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
Thank you. So let's start with warm-up questions. The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
Being a nurse, you were having a lot of responsibilities during the COVID-19 outbreak. How did you work during the COVID-19 pandemic?
Considering the fact that nurses constitute the majority of healthcare providers, we have a critical function in healthcare systems. Our roles in treating patients with COVID-19 involves triaging patients and detecting suspected cases with infections, providing essential treatment in an emergency, and dealing with suspected patients with precautions, helping in decontamination and coordination with other healthcare providers, supplying holistic nursing practices in managing multiple infections simultaneously, playing critical roles in expanding care services, and dealing with relatives. In crises, we have more tasks to satisfy patients and their families. Therefore, nurses must be well equipped with essential knowledge and skills in managing crises involving clinical treatment, decontamination, isolation, communication, triaging, psychological support, and palliative care if necessary. However, when we respond to a crisis such as COVID-19, we face problems that hinder us from caring for the infected patients.
What are the protective measures for nurses during COVID-19?
The first protective tool is adequate education for us, and training content includes the use of personal protective equipment, PPE, hand hygiene, ward disinfection, medical waste management, sterilization of patient care devices, and management of occupational exposure. The PPE sets include a disposable work hat, an N95 respirator, inner gloves, a protective eye mask, protective clothing, disposable waterproof shoe covers, disposable isolation gowns, outer gloves, and a face shield. Due to the complicated procedure of putting on and removing the PPE, the recorded video was sent through groups in different social media where all nurses could review the operation details at any time.
How shifts were managed during COVID-19?
With the rapid increase in patients, which will cause severe nurse shortages, it was extremely important to establish a scientific, reasonable nursing shift schedule. We have tried 3 shift schedules. First, 4 hours of work in the morning and 4 hours of work in the afternoon with an 8 hours interval. Secondly, 6 hours of continuous work. And third, 6 hours of continuous work, with the next nursing shift overlapping by 1 hour at the end of shifts. After a week's trial of the different shifts, a questionnaire survey was conducted to investigate the preferred shift schedule. The most preferred was the third schedule for the following reasons. Putting on and taking off PPE twice a day increased medical resource consumption. Frequently moving between contaminated and clean areas increased the risk of infection. Frequently going through the complicated procedures of putting on and taking off PPE increased the mental burden. Working for 6 hours continuously pushed the physiological limits, as we could not go to the bathroom when wearing PPE in the isolation area, and often felt groggy or tired at the end of work. And having 1 hour of overlap between shifts provided flexibility and facilitated the handover, which reduced nurses' mental stress and the possibility of adverse events. In addition, the 1 hour overlap allows 2 nurses to cooperate in finishing tasks that are difficult for a single person to complete, such as administering injections to and drawing blood from children, changing sheets, and performing terminal room disinfection.
What all psychological support was received for nurses during the COVID-19 period?
The risk of COVID-19 infection may cause significant psychosocial stress for medical staff. Unfortunately, Several young medical staff members infected with COVID-19, whose cases appear to be mild at the early stage of the disease, recently sharply deteriorated and died, further increasing the fear of the virus. To relieve the mental stress of nurses, the head nurse has a 30-minute meeting with nurses, who will work in the isolation area on the next day, to make them aware of the adequate equipment and resources in our hospital, the observers who will send instant aid if necessary, etc. Furthermore, nurses were protected and evaluated the first moment we feel any discomfort. Nurses with symptoms of anxiety or insomnia are encouraged to seek help from psychotherapists on our team, on duty 24 hours a day, who will evaluate them and help them deal with potential stress and depression.
How do you avoid unnecessary contacts during coronavirus pandemics?
Avoiding unnecessary contact is critical for minimizing cross-transmission. Our department was equipped with well-established hospital information systems, personal digital assistant systems, and a local intranet. All wards are entirely monitored by cameras, so we can achieve the following. 1. All medical documents including physician's order sheets, medical records, consent information, examination results, and nursing materials were made paperless. 2. Nurses and doctors can monitor the situation in each room in real time, and depending on the situation, doctors and nurses can give remote assistance to avoid unnecessary contact.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. Now you can start your role play. Don't worry if I stop you when the time is up.
Good morning. My name is Andrew Mars, one of the nurses in the emergency department. How may I help you today?
Nurse, I have got a cat scratch on my arm. I have been waiting here for the last 45 minutes to consult the doctor.
Oh, I am so sorry to hear that has happened to you. I apologize for the delay, and I can assure you that you will be able to see the doctor without any further delay.
Okay.
For the purpose of documentation, can you tell me your full name, please?
My full name is Victoria Reyes.
Thank you, Victoria. Well, for clarification, I need a few details of your condition.
Excuse me, nurse. I want to see the doctor immediately, rather than answer your questions. Kindly make the necessary arrangements for that.
I can feel you are a bit nervous. Try not to worry. Kindly cooperate with me, because I am collecting the details as part of your treatment.
Why should I say it to you? During the consultation, I can tell these directly to the doctor. Isn't it?
Victoria, your thoughts are sensible, and I can understand your situation. But, before seeing the doctor, details will be collected. So that, by the time you get the doctor's consultation, he will be having sufficient details with him. Hence, you can be treated appropriately, and without being delayed further.
Oh, is it?
Yes, Victoria. So, for my better understanding, please explain the accident in detail.
Okay, I will. My pet cat scratched my arm badly yesterday, and made it bleed.
Oh, it's hard to hear. Do you have any idea how severe the wound is?
Yes, nurse, the scratch is deep, and the injured area now looks red and inflamed.
It doesn't feel good to hear, Victoria. Anyway, thank you for your information.
Actually, I am very anxious about the wound.
Your worries are understandable. Be calm, nothing wrong will happen. You will get consulted soon.
Okay.
Victoria, did you take any first aid, or do any treatment at home?
I was not sure what to do. So, I have just washed the affected area several times. Other than that, I haven't taken any treatment.
I appreciate that you acted appropriately. It is the most recommended thing to do.
Oh, really?
Yes, it is. On the other hand, we will wash your wound here again, to make it clean and safe.
No problem.
Victoria, may I know about any other symptoms you are experiencing?
Nurse, I have not experienced any other symptoms, not even feverish. Nevertheless, I wish to see a doctor very soon, as I still think the injury may be serious.
I can understand how difficult it would be for you in such a situation. If I were you, I would have been in the same condition. The department was busy due to emergencies, which caused the delay.
All right. When could I see a doctor then?
Victoria, your question is quite reasonable. But, before getting consulted by the doctor, I have to take your vital signs, such as BP, temperature, pulse.
But, why is it necessary?
Your thoughts are sensible. However, it is essential to record your reading, so that the doctor will have a better understanding of your condition.
Is it relevant to my treatment?
Definitely, it has relevance in your treatment, Victoria.
All right, then you may please.
Thank you for your consent. Also, kindly allow me to check your wound before the doctor looks at it. It will help me to provide an insight to the doctor about your condition.
Sure, you may please.
Thank you for your cooperation. I have noted the details, and it will be forwarded to the doctor. I can assure you that there will not be any further delays to see the doctor. Please be patient.
Okay. That is the end of your OHE speaking roleplay. All the best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.